You get the reminder in the mail for your annual checkup. You schedule the appointment, you go into the clinic, and you follow your doctor's advice, doing all of the routine tests they recommend. You walk out of that building feeling responsible, feeling like you have done the right thing to protect your health for another year. But what if that feeling of safety is misplaced? What if one of those routine tests done just in case could actually be the very thing that triggers a dangerous chain reaction inside your body, leading to dizziness, confusion, or even a stroke just a few days later? It is a terrifying thought that the very system you trust to protect you could, under the wrong circumstances, actually put you in harm's way. Today, we are not telling you to distrust your doctor or to avoid necessary medical care. Absolutely not. We are here to give you the knowledge you need to become a true and equal partner in your own healthcare. We are going to teach you how to become an empowered patient. To guide us on this very important journey, we are so honored to have Dr. Shigeaki Hinohara with us. Doctor, welcome.
Thank you for having me, Ben. This is a very important topic. The best doctor in the world cannot know your body as well as you know it yourself. True healthcare is not a dictatorship. It is a partnership. The wise patient does not just follow orders blindly. The wise patient listens to the doctor's advice and then asks intelligent, respectful questions. Today, our goal is to teach you what those intelligent questions are.
And that is our exact mission. In this detailed guide, we will examine 5 common medical tests that can carry hidden risks for seniors. For each of these 5 tests, Dr. Hinohara will explain the potential risk from his decades of patient experience. I will then explain the simple science behind that risk. And most importantly, for each test, we will give you a list of smart questions that you can write down and ask your own doctor before you agree to proceed. It is our responsibility and our blessing to be active participants in our own care. If you are ready to become a more empowered and informed patient, please type the number 1 in the comments below. And be sure to subscribe to our channel. It's completely free. And this information could be one of the most important things you learn for your health this year. Okay, doctor, let's get right into this important guide. Let's start with a category of tests that many people in our audience have likely experienced. These are the scans that sometimes require an injection of a special dye into your vein to help the doctors see the images more clearly. What is the first common test in this category?
The first is the CA scan with contrast. The contrast dye, which is usually iodine-based, is very helpful for the doctors to see your blood vessels and organs. However, for an older body, and especially for a body that already has some existing challenges with the heart or the kidneys, this injection of dye can be a sudden shock to the system. Let me tell you about a patient of mine, an 81-year-old man named Arthur. He went to the hospital for some minor abdominal pain. As part of a thorough checkup, the doctors performed a CT scan with contrast. The good news was that the scan itself came back looking normal, and he was sent home feeling fine. But 2 days later, his wife found him in the morning feeling very confused, and he had developed a noticeable weakness on his right side. He had suffered a small ischemic stroke. The doctors believed the most likely trigger was the physiological stress that the contrast dye had placed on his already vulnerable cardiovascular system.
That is a frightening story because it happened after he was given the all clear from the test itself, and the science explains how this can happen. In some seniors, the contrast dye can trigger what's called a vasovagal reaction. This can cause a sudden and dramatic drop in both heart rate and blood pressure that can lead to fainting. But in other people, especially those who already have high blood pressure, the body can have the opposite reaction. It can react to the dye with a sudden and sharp spike in blood pressure. A study published in the Journal of Vascular and Interventional Radiology confirmed that older adults with a history of hypertension or kidney disease have a significantly higher rate of these kinds of complications in the 72 hours following a contrast-enhanced scan.
So this does not mean you should refuse a necessary test. It means you must become a good and wise partner with your doctor. You must ask the right questions before the test.
Exactly, and this is the most important part of our video today. Let's give our viewers the smart questions to ask. What is smart question number 1 for a CT with contrast?
The first question is about your personal risk.
That's right. You should ask your doctor directly. Doctor, based on my personal age and my history of blood pressure and kidney function, what are my specific risks with this contrast dye? This question shows your doctor that you are aware and you are thinking about your own safety.
The second question is about finding a simpler way.
Yes, you should ask, is this contrast scan absolutely essential right now? Or is there a safer, non-contrast alternative, like a regular CT scan or an ultrasound that we could try first?
And the final question is about preparation.
Ask your doctor, what steps can we take before and after the scan to protect my kidneys and to ensure that I am very well hydrated to handle the dye safely? These 3 questions can make all the difference. Now let's talk about the other common scan that uses an injection, the MRI, with contrast. Is the risk the same?
The risk is different, and in some ways, it is more subtle. The contrast dye that is used in most MRIs contains a heavy metal called gadolinium. This reminds me of Harold, a 79-year-old veteran. He had a contrast MRI for some persistent back pain. He had no idea that his kidney function was already a little bit weak for his age. 2 days after the scan, he began to feel extremely weak, dizzy, and mentally foggy. These strange symptoms lingered for nearly a week. It was only when his primary care doctor ran new lab tests that they discovered he had stage 3 kidney disease. He told me no one warned me that my kidneys might have a hard time with the dye.
And Harold's story highlights the specific danger here. Your kidneys are supposed to filter out 100% of the gadolinium. But if your kidney function has slowed down with age, which is very common and often goes undiagnosed, your body may not be able to clear all of it. The retained gadolinium has been linked to a rare but serious condition that causes hardening of the skin and joints. More recently, studies in the respected journal Radiology have shown that it can also be deposited in brain tissue, which is a major concern.
So, again, we must ask the right questions before this test. What is the first smart question for an MRI with contrast?
Question 1 is simple. Given the known risks of gadolinium retention, can we get the diagnostic images we need with a non-contrast MRI first? In many cases, the answer is yes, and you can avoid the dye altogether.
And what if the doctor says the contrast is truly necessary for a clear diagnosis?
Then you ask the second smart question, which is really a request. Before we proceed with the contrast, could we please do a simple GFR blood test to confirm that my current kidney function is strong enough to handle this dye safely? This simple blood test can give both you and your doctor peace of mind. It's about being a wise steward of the body we've been given, ensuring that the tests designed to help us don't inadvertently cause harm. Okay, doctor, we've covered the risks that can come from what is injected into the body. Now let's talk about our next category of risk, which comes from putting the body under different kinds of physical stress. Let's start with a very common test for heart health that many of our viewers have likely had, the treadmill stress test.
Yes, the stress test. The idea behind the test is logical to see how your heart performs under pressure and stress. But for an older body, especially one that may have hidden vulnerabilities, sometimes that pressure can be too much too quickly. The risk is that the test itself can trigger the very event it is trying to predict, The source material you shared with me told the story of Margaret from Ohio. She was 74 years old and had her high blood pressure well controlled with her daily medication. She felt fine. As part of a routine checkup, her doctor recommended a stress test. Halfway through the test, as the treadmill got faster and steeper, she began to feel very dizzy and had a tightness in her chest. The technicians stopped the test immediately, but the intense stress had already caused a problem. The next day, she suffered a minor stroke. The sudden extreme demand placed on her system was too much for a fragile blood vessel in her brain.
That is such a frightening scenario because she was doing what she was told was a preventative test. And the science explains what likely happened to Margaret. When you are pushed to your maximum level of exertion on a treadmill, your heart rate and your blood pressure shoot up very rapidly. For a senior who may have underlying arterial stiffness or some plaque in their arteries that they don't even know about, this sudden surge in pressure can be dangerous. A 2020 study published in the American Journal of Cardiology looked at over 1,300 seniors who underwent this exact test. They found that a significant percentage experienced harmful events during the test, including dangerous blood pressure surges and abnormal heart rhythms or arrhythmias.
So this brings us to our smart questions. This is not to say you should refuse a test your doctor feels is critical. It is to say you should have an intelligent conversation first.
Exactly. The first smart question is, Doctor, since I am not currently having any active symptoms like chest pain or shortness of breath, what is the specific question this test is intended to answer for us right now? This helps to clarify if the test is truly necessary or just routine. The second question is about alternatives. Ask, are there any less physically stressful ways to evaluate my heart? For example, could a nuclear stress test, which uses medication instead of intense exercise or simple resting echocardiogram, provide the information you need?
Asking about safer options is always a wise thing to do.
It is. Now let's talk about another very common procedure that introduces a different kind of stress to the body, the stress of sedation. Let's talk about the endoscopy, such as a routine colonoscopy.
Yes, the procedure itself in the hands of a skilled doctor is often very safe. The hidden risk for a senior often comes from the sedation, especially when it is combined with the other medications that a person may be taking every day, like blood thinners. I remember the case of a 76-year-old woman named Judith. She went in for a completely routine screening colonoscopy, a test that saves many lives. She was taking a daily baby aspirin for her heart health. 2 days after the procedure, she began slurring her words, and she lost coordination in her left hand. The doctors at the hospital confirmed she had experienced a mild ischemic stroke. They believed that the combination of the sedation and her daily aspirin had created the perfect storm for a small clot to form and travel to her brain.
And here's the science behind that perfect storm. The medications used for sedation are designed to relax you. They naturally cause your blood pressure to drop and your breathing to become more shallow. This can create what is called a low flow state in the brain circulation. At the same time, if you are on a blood thinner, like aspirin, your blood is less able to resist clotting if and when it slows down. This combination of slower blood flow and thinner blood can, in some vulnerable individuals, increase the risk of a clot forming. A large review published in the journal Gastrointestinal Endoscopy confirmed that there was a significant increase in mini strokes, or TIAs, in the 72 hours following sedated procedures in people over 65.
So once again, we must ask our smart questions.
That's right. The first question for your doctor is, what are the specific risks of this type of sedation for a person of my age and with my specific health conditions? The second question, and this is critical, is we need to make a very clear plan for my blood thinner medication. What is the exact schedule for stopping it before the procedure? And when is it safe for me to restart it afterward? Miscommunication on this one point is a huge source of problems.
And the final question.
Ask is a lighter form of sedation, or in some cases, no sedation at all, a possible option for this procedure. These questions are all about being an active participant in your own care. It's a part of our God-given responsibility to be wise and careful with our health. This is such important information. We are blessed to be able to share it with our global community. To help us see that community, please let us know what city, state, or country you are watching from. We love seeing how this message connects people everywhere. Doctor, we've covered the risks that can come from injections, from putting the body under physical stress, and from the effects of sedation. Our final test on the list today is different. It is a test that is completely painless, non-invasive, and has no physical side effects at all. But in its own way, it may be one of the riskiest of all for a different and much more subtle reason. Let's talk about the routine carotid artery ultrasound.
Yes, this is the most subtle risk because it is a paradox. As you said, the ultrasound test itself is perfectly safe. It is the same technology used to look at a baby in the womb. The danger is not the test itself. The danger is what can happen after the test, especially when it is performed on a person who has absolutely no symptoms of a stroke.
Can you explain that? It sounds very counterintuitive. How can getting more information about our health possibly be dangerous?
Because sometimes that information can lead to a chain reaction of fear, which can lead to an unnecessary and risky action. Let me tell you the story of Helen, an 82-year-old woman from Pennsylvania. She went for her annual checkup, and she felt perfectly fine. She had no dizziness, no vision problems, no weakness, no signs of a stroke at all. But because of her age, her doctor ordered a carotid ultrasound just to be thorough. The test found that she had a 65% blockage or narrowing in one of the main carotid arteries in her neck. Now that number sounds very, very scary. She was, of course, very frightened. She was immediately referred to a vascular surgeon, and the surgeon, seeing that number, recommended a procedure to clean out the artery. Within a few weeks, she underwent a major surgery called a carotid endarterectomy. Sadly, during the recovery period after the surgery, a small piece of plaque broke loose from the site of the operation, traveled to her brain, and she suffered the very stroke the surgery was meant to prevent. She survived, but she now lives with partial weakness on her right side. She told me later with great sadness, "I wish I had known that just leaving it alone and managing it with medication might have been the safer choice for me."
Helen's story is absolutely heartbreaking, and it is the exact scenario that a landmark study published in one of the world's most respected medical journals, the New England Journal of Medicine, warned us about. The study followed over 3,000 seniors who had moderate carotid artery narrowing just like Helen, but had zero symptoms. What they found was shocking to many in the medical community. For a large number of these asymptomatic patients, managing the condition aggressively with modern medication like statins to stabilize the plaque and blood pressure pills to reduce stress on the artery combined with a healthy lifestyle was just as effective at preventing a future stroke as undergoing the risky surgery. And even more troubling, as happened to Helen, a small but significant percentage of patients who underwent the preventative surgery actually experienced a stroke as a direct complication of the procedure itself. So for a person with no symptoms, a routine test can lead to a major surgery where the risk of the cure may be greater than the risk of the disease.
So this is why the SMART questions are so very important in this situation.
Exactly. This is where you must become your own best advocate. If your doctor suggests this screening test and you have no symptoms here, are the smart questions to ask. The first question is about the purpose of the test. Ask your doctor directly, "Doctor, since I feel perfectly fine and have no symptoms, what is the specific goal of this test? And how would a positive result actually change the medications or the lifestyle plan that I am already on?"
That is a key question. The second question is about the path forward if a blockage is found. You should ask, if this scan does find a moderate blockage, can we agree that our first course of action will be to manage it aggressively with the best medications and lifestyle changes rather than immediately considering a surgical referral?
And the final and most direct question you can ask for any recommended surgery is this: what are the known complication rates, including stroke, for this specific surgical procedure at this specific hospital? You have a right to know the real risks of the intervention. Asking these questions is not about disrespecting your doctor. It's about being a wise and faithful steward of your own body, working in partnership to make the best possible decision for your life. So here's the bottom line. This video is not about creating fear of medical tests. These tests save lives every single day. This video is about empowerment. It is about understanding that the key to great senior health is being a wise and active partner in your own healthcare. By asking these smart questions that we've discussed, you can help your doctor make the best possible decisions for you, ensuring that a test intended to prevent a stroke doesn't inadvertently increase your risk. This proactive questioning approach is a powerful tool for your senior health. It helps you navigate the complexities of modern medicine and reduce your risk of a stroke from every possible angle. This is truly the most important habit you can build for your long-term senior health, being an informed and engaged advocate for yourself.
I want to leave you with this one final thought. Your health is your greatest treasure. It is your responsibility to care for it. Your doctor is your most trusted advisor on that journey. A good partnership between a patient and a doctor is always built on good, respectful questions. Do not ever be afraid to ask. A wise question is not a sign of distrust. It is a sign of great strength and self-respect.
That is the perfect message to end with, Doctor. A wise question is a sign of strength. It's about being a good and responsible steward of the one body we are blessed with for our entire lives. And of course, the information we've shared today is designed to help you formulate those good questions. It is for educational purposes and is not a substitute for the direct medical advice and recommendations of your own personal physician who knows your full health history. If you found this guide empowering and helpful, please give this video a like so that others can find this vital information, and be sure to share it with a friend or family member who you want to help navigate their healthcare with confidence. If you haven't already, please subscribe to our channel. It is completely free and it ensures you will not miss our next honest and practical health guide. And for our community discussion today, we would love to know, what is one smart question you learned today that you will remember for your next doctor's appointment? Sharing your takeaway in the comments below can help everyone in our community become more empowered patients. Thank you for being with us. Be wise and be well.